Hai, Assalamualaikum warahmatullahi wabarakatuh. My name is SYAQIRAH NABILA BINTI AHMAD SYAFRI HUSNAINI, and I'm from HM 241-6D1, and I choose HR Policies and Procedure Training. The objective of this program is to ensure all staff are aware of the understand Serenity Hospital's HR policies and procedures, to educate participants on relevant employment laws and compliance, and to empower employees with knowledge of their rights and responsibilities within the organization. For the event facilitators, we have Sarah Johnson, which is our HR manager, and Mikael Smith, which is our legal advisor. The venue is at Serenity Hospital Training Room at Kuala Lumpur, Malaysia, and the duration is about 8 hours, and the participants is 25 participants. And our training method is interactive workshop, presentations, and case studies. For the program schedule, we have 5 sessions, which are: the first session is Introduction to HR Policies and Procedures. The second session is Employment Law and Compliance, and we have lunch break. For the session 3 is Employee Rights and Responsibilities. Session 4 is about case studies and group discussions, and last session, which is session 5, is question and answer session and wrap up. Next is for the expenses. For this event, our budget is about 8,000 ringgit, and first of all is venue rental, which is about 2,000 ringgit, facilitator fees 3,000 ringgit, training materials 1,000 ringgit, refreshment 1,000, audiovisual equipment 500 ringgit, and last but not least is miscellaneous, which is 500 ringgit. For the evaluation method, we have 3 methods, which are pre-training assessment, post-training assessment, and evaluation form. For the pre-training assessment, the participants need to answer the survey before the workshop starts. The question in this pre-training assessment focus on understanding current level of experience and their specific learning objectives for the workshop. For the post-training evaluation, which is referred to the assessment conducted after a training program to measure its effectiveness, impact, and outcomes. And last but not least is evaluation form, which is a structured document or questionnaire used to gather feedback, opinions, or assessment about the workshop. This is the examples of training video.
Hi, good morning. I'm Steve Warner. I'm the invigilator for the OET test conducting on 28/04/2020. May I know your name, please? Hi, good morning. My full name is Ronnie Parker. Can I have your passport, please? Yes, sure. Can I have your candidate number, please? My candidate number is 156792. All right. We can now begin the warm-up session. What do you find difficult about being a nurse? I think the most difficult part of being a nurse is when I have a patient who is very unhappy or in a lot of pain, and I can't comfort them to the degree I'd like to. I keep a dialogue going with the attending physician so that she has as much information as possible regarding the patient's pain level. Sometimes the patient doesn't effectively communicate with the doctor, and I try to help bridge that communication gap. Do you prefer to work alone, or as part of a team? Nurses often need to do both, work independently, and also collaboratively. That depends on the circumstances. I enjoy being part of a treatment and support team, but I also like the autonomy of working alone. How would you handle a patient who complains constantly of pain? I would listen sympathetically to the patient's complaint, and reassure the patient that his or her concerns were being heard and that we were doing everything possible to help. If it seemed warranted, I'd confer with the attending doctor to make sure that the patient's pain was being managed in the most effective way. What do you contribute to your patients as a nurse? I feel that my patients know that I am there to provide comfort and understanding, that I will listen to their concerns, and that I will act as their advocate if necessary. How would you deal with a doctor who is rude? Everyone has bad days. If the rudeness is a one-time occurrence, I'd let it go. If something major happens, or if it's repeated, I'd reach out to my supervisor. My concern would be that perhaps the doctor was being rude not because of a bad day, but because of dissatisfaction with my work. That's the end of the warm-up session. Now we can move on to cue card sessions. I'll help you with the task questions. This is your task card. You have 3 minutes to prepare with the task card. Your time starts now.
That's all from me. Thank you.